I'd like to call this meeting to order, and everyone will rise. Have the Pledge of Allegiance, please. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Christine, would you take roll call, please?
Director Danielson,
Present.
Director Wallace,
Present.
Director Stewart,
Present.
Director Nicholson,
Present.
Director Epen.
Present.
I would like to now just modify the agenda just a little bit, take it out of order, and go to the first action item. Dr. Stewart?
Madam President, I move for the presentation of the commendations of the Washington Hospital physicians and staff for the Bohol, Philippines medical mission. With heartfelt recognition and sincere appreciation, Washington Hospital Healthcare System and the Washington Township Healthcare District acknowledge and praise Carmen Akawili, Kranti Achanta, Goni Sandhu, Brian Smith, Kadir Halimi, Janice Menyuk, Radora de la Cruz, Apollo Kayabab, Athena Albino, Claire Johnson, Kim Sullivan, Gina Arguletas, Cherry Escardo, Lydia Kapasin, Araceli Simeon, Nick Saluxian, and Dan Dublin.
Second.
Oh, well, I'm not done
You're
yet.
not done?
He's not done.
Oh, okay.
I'll tell you when I'm done. For their genuine act of humanitarian services offered through the comprehensive surgical, medical, dental, eye, and health education mission conducted in the province of Bohol, Philippines on January 19 to 23, 2015. That benefited the province's financially challenged and less privileged constituents. With highest regards and accolades, Washington Hospital Healthcare System and the Washington Healthcare District proudly present this certificate in honor of these individuals, duly bestowed this 13th of May, 2015.
I'll second it again.
The motion has been made and seconded. No discussion? Roll call. Okay, roll call.
Director Danielson,
Aye.
Director Wallace,
Aye.
Director Stewart,
Aye.
Director Nicholson,
Aye.
Director Epen.
Aye.
This motion passes. We do have some commendations for the folks who are here in the audience. Do we want to just ask them to come up? And we have the commendations there, and I think we have everyone here in the room.
Yeah.
Yes, would you like to come up? Don't be shy.
Carmen, wait, we want to take your picture.
No, don't go away, don't go away.
It's going to be picture time, so it's okay. I was going to thank Nancy. Carmen, you're wonderful. You were a treasure. I love you. You guys did beautiful, beautiful. You know, all of you did it together. And it's a beautiful thing, and in this world where everybody's busy killing each other, that, and that's the quote, I'm traffic director. Thank you. Mr. Hooney, thank you. You guys are wonderful. Thanks. Isn't she wonderful? She's a treasure. We need somebody to organize
We
this.
can just get everybody to line up here and move together.
Thank you. It was a wonderful thing you guys did.
Yeah, come together. You guys gotta come together.
Everybody more go to see them.
Carmen, come stand here. See the meeting, Carmen. Come stand here.
You guys are in the center over here.
Yes, yeah.
Okay.
Hold your,
Everybody,
nice and straight.
okay, right side out.
Show your certificates nice and straight.
Okay.
All right, here we go. 1, 2, 3. 1, 2, 3. And 1, 2, 3. And one more. 1, 2, 3.
Thank you.
Your chair is in the way. Well, that is a great way to start a meeting. It really is. A highlight with that. It was fabulous. We'll now go back to the regular agenda alignment, and we have the educational session. Nancy, would you give the introductions, please?
I'm very proud to present Stephanie Williams to the Board of Directors tonight. As some of you might know, last week was National Nursing Week. This week is National Hospital Week. And it's very appropriate that Stephanie's here to address the board in her education session. While some of you might know, she's been here for more than 15 years. She's a registered nurse with a master's degree in healthcare administration and is a certified professional in healthcare quality, as well as a board-certified nurse executive. Stephanie is the current chief of nursing, and she's an associate administrator of the hospital with oversight for quality and resource management, compliance, health information management, and the patient care services division, including med-surg areas, critical care, stroke, emergency room, special care nursery, and the maternal and child health departments. She previously was our chief of quality and resource management, in which she had oversight of quality, case management, social services, spiritual care, and diabetes. With that, I'd like to turn the program over to Stephanie.
Each year, the National Nurses Week begins on May 6th and ends on May 12th. It's Florence Nightingale's birthday. The theme this year is My Patient, My Code, My Practice, Ethical Decision-Making and Action. It acknowledges the strong commitment, compassion, and character nurses display in their profession every day. Let's look at a history of ethical nursing practice. Florence Nightingale, back in 1893, she was the first nurse to embrace the concept of do no harm. Hence, we have the Florence Nightingale Pledge. I will do all in my power to maintain and elevate the standard of my profession. The first book on nursing ethics was written in the 1900s. It was written by Isabel Hampton Rubb. And she quoted, "The spirit in which the nurse does her work makes all the difference." The American Nurses Association Code of Ethics for Nursing was developed in 1950. It was revised in 2001, and then it was further revised in 2015. One of the quotes that came out of Fowler and Benner, "It is not the possession of nursing credentials, degrees, and position that makes a nurse a nurse. Rather, it is the very commitment of patient care." In recognition of the ethical practice, the American Nurses Association has designated 2015 as the Year of Ethics. They have revised the code in 2015 that calls on nurses to improve the ethical environment of work setting and condition of employment so that it's conducive to safe, quality health care. So let's talk a little bit about the American Nurses Association Code of Ethics for Nurses. these are guidelines that the nurses should practice with compassion and respect. They need to be committed to the patient. They need to strive to protect the health, safety, and the rights of the patient. They must be responsible and accountable for nursing care. And they have to preserve the integrity, competency, and professional growth. So how does Washington Hospital implement the Code of Conduct and Ethics? It's the patient-first approach. It's optimal outcomes and best quality of patient care. Nurses have a voice in administrative decision-making. Nurses have autonomy to make the best decision for patient care. So let's talk about ethical nursing. If you look at the definition of ethics, it is the study of philosophy that deals with the distinction between right and wrong and the moral consequences of actions, and the meaning of morals pertaining to the rightness or wrongness of an act. So why is this important? Despite recent changes under the Affordable Care Act, communities continue to rely on nurses to be their advocates and protect their health and safety. Nurses have been voted the most honest and ethical professionals for 13 continuous years by the American public. This was done through a Gallup poll. Nurses, however, face ethical dilemmas on a daily basis. And dealing with those ethical decisions requires a supportive work environment and a professional path that paved the work for nurses' voices to be heard. And we have that here at Washington Hospital. So what does Washington Hospital do to support ethical decision-making? Value is placed in creating a work environment that fosters respect and professionalism. Nurse leaders are encouraged to have open conversation about ethical issues. Employees are encouraged to report events anonymously through an online incident report tool and also through the compliance hotline. Nursing Administration and Human Resources Department maintain an open door policy. We have an institutional review board at Washington Hospital independently review every clinical research project prior to the implementation. Nurses are trained to provide culturally sensitive care to meet the needs of our diverse community. Washington Hospital has a bioethics committee. The committee meets regularly and make multidisciplinary rounds in the critical care unit. The committee's members are available to consult on a 24/7 basis. We have policies and procedures that drive what we do. And since April of 2014, a presentation to the board and community regarding advanced directive. We are also in the process of implementing a palliative care program. So why is this important to Magnet? The organization's support for ethical decision has aided us in our journey to Magnet. Over six years ago, Washington embarked on the Magnet journey to establish clinical excellence in decision-making to support quality and ethical care. The emphasis with Magnet is on patient-clinical relationship, collaborative care, dignity in care. So this goes back to the ethical decision-making. So let's talk a little bit about the Magnet recognition. Magnet status is the highest honor for nursing excellence awarded to the hospital with the gold standard of nursing care. But it's not just to nurses, it's to all employees that have a commitment to provide a superior patient care experience. It's awarded by the American Nursing Credentialing Center, and only 6% of the U.S. hospitals are Magnet recognized, total of 402 facilities nationwide. So how does Magnet status help nurses in ethical decision-making? Magnet organizations have an ethical and professional responsibility to patients. Nurses are urged to intervene early and take control of their patients. Leaders provide guidance and support for nurses, and we have been a Magnet facility since 2011. So continuing on the Magnet journey, as part of the recognition, we have to submit annual reports to the Magnet. And these reports include demographic data, such as the number of nurses, the turnover rate, certification, and the education of our staff. We are currently preparing for a magnet redesignation. The final document is due August 1st. You're going to hear more about what's included in that documentation. We have received a grant from the Gordon and Betty Moore Foundation in March to help support the redesignation process. So what does magnet means to our community? It means the highest quality of care. It means a stable workforce, longevity of our staff. It means we have experienced and attentive nurses, and we have a well-educated and trained staff. So this is the 2014 magnet model. There are 5 components, and you'll be hearing more about the components as I proceed. The first one is transformational leadership. So what is transformational leadership? It's strong nursing leadership who have the vision, the knowledge, and the influence to guide their team where it needs to go, not just where they want to go. The leaders are visionary, inspiring, and strategic. So here are the components of transformational leadership. Strategic planning. The nurse strategic plan must align with the organization plan for top performance, and the sources of evidence are just examples of what we have to provide in the documentation. Advocacy and influence. Leaders must advocate for support on behalf of the staff and patients. Visibility, accessibility, and communication. The nurse input is valued, and the CNO must effectively influence change. So let's look at some examples of transformational leadership. This is an example of where the critical care nurses implemented a medicated bath as a quality improvement measure to decrease the central line associated bloodstream infection in critical care. This was led by the nurse manager. It was led by the clinical nurse specialist, and we have had excellent results in terms of being able to decrease bloodstream infections. Another example is the CNO must be involved in decision making. We implemented a clinical documentation improvement program, and the goal of the program was to promote accurate and valid reporting of procedures and diagnosis to make sure that the documentation accurately reflects the patient condition. So that was one of the roles that the CNO was involved in the decision making. Here is another example where the CNO influences professional development. These are 4 of our nurses that have transitioned to leadership roles. And 2 of them are here tonight. 3 of them are here tonight. You guys want to stand? LV? There they are. Thank you. Another example is Washington Hospital provides support and growth opportunities for nursing to develop and exceed in their profession. We started a new grad program in 2003. Since we have started that program, 271 nurses have gone through that training program, and we have a retention rate of 72.8% of those new grads are still with us today. We are maintaining excellence by recruiting the best in nursing. We have started a specialty program for the OR, labor and delivery, and the catheterization lab, and these are areas where it's difficult to recruit. Let's talk about structural empowerment. Structural empowerment needs strong nurse leaders to create an environment where the hospital mission and vision come to life, and the nurses are encouraged to achieve results. So let's give some examples of what that includes. In terms of looking at the structural empowerment, The standards are professional development, commitment to professional development, teaching and role development, commitment to the community, recognition of nursing. So here are some examples. Washington has a history and tradition of encouraging staff to grow and develop their professional interest and advance in their career. The Washington Hospital Career Ladder Program was established in 2001 to support employees through career transition and professional advancement. As of 2015, 55 employees have been enrolled in the program, of which 32 were nurses. And there are some examples of Gina, Liz, and Sherry, all nurses. It started off as either business assistant, staffing clerks, CNAs that have transitioned to RN and to nursing. The hospital has a clinical ladder program. The clinical ladder program is a nursing recognition system which rewards excellence demonstrated in nursing practice and nursing leadership. As of 2015, we have 36 staff nurse 3s and 11 staff nurse 4s, and it's growing daily. The tuition reimbursement program. The program was established in 1991 to financially support employees' education advancement. Over 300 Washington Hospital employees have been supported through the program. Half of these employees were nursing staff, 150 nurses. Here are some examples of structural empowerment. This is the certification, and the one on the right is the advanced degrees. And you can see we are steadily climbing in terms of the percentage in terms of certification and the percentage of the advanced degree. By 2020, Magnet required that 80% or more of your clinical nurses have a BSN degree or higher. This is another example of structural empowerment, supporting nurses' growth and development. Nursing leadership is committed to nursing career development and providing opportunities for career advancement. Here an example of a new grad, came to us in 2009. She was a med-surg nurse. She was very involved in EPIC implementation. She wanted to be a critical care nurse. She was supported and mentored through that process, and right now she is working in critical care. Exemplary practice. Exemplary practice is a nurse practice model that includes working together, communicating, and developing professionalism to achieve the highest quality care for patients and the community. It's the evidence-based care, safe and evidence-based care. So what are the standards that Magnet required? There has to be a professional practice model. There has to be a care delivery system, and they have to be involved with staffing, scheduling, and budgeting. There must be interprofessional care. There has to be accountability, competency, and autonomy. Ethics, again, privacy, security, and confidentiality. A culture of safety, a quality care and monitoring improvement. And keep in mind that every one of these standard or goal, we have to come up with sources of evidence for. We have to come up with the data to show that we have done it, and we have to come up with the stories that tell exactly what we're doing and how we are meeting the standards. So here is an example of an exemplary practice. The baby-friendly initiative, the breastfeeding policy. Washington Hospital has met and sustained the baby-friendly initiative goal of over 90% infant breastfed within the first hour of life. And as you know, we are a baby-friendly organization, so we are recognized nationally for that. This is where the authority of nurses to create change. Nurses wanted there was some changes made to the infant abandon policy. The nurses got together, they reviewed it, they revised the protocol, they identified what was necessary, they worked together to review the protocol and ensure compliance. The hospital staff protocol was changed, nurses implemented, staff educated. new knowledge, innovation, and improvement. And this is the last of the standards. And this one talks about nursing taking the lead in research efforts and have an ethical and professional responsibility to contribute new findings, evidence, and quality improvement to the nursing profession. So what's included in the new knowledge? It's research. Nurses make visible contribution in the science of nursing, evidence-based practice. Existing evidence is used to improve practice at the bedside. Innovation, nurses stay current on new models of care using evidence to optimize patient care. So here is an example of innovation in nursing. The nurses took the lead in decreasing the wrong route. There was a difference in whether it was IV or whether it was subcutaneous. The example they used was heparin. So there were many near misses. So the nurses worked with Epic to create a function in Epic where it forced the function where sub-Q became the route of choice. And sub-Q is the best practice for heparin. And since they have made that implementation and that intervention, there have not been any more near misses or any more errors related to the wrong route. And this has gone from heparin to other medications right now. So when you look at the Magnet vision, you have the leaders who are transformational, you have the empowered structure for care, you have practice that's exemplary, that's care at the bedside, you have new knowledge and innovation, and then you have the best outcomes. And with that, I want to say happy hospital and belated Nurses Week, and I truly want to thank the board and our CEO, Nancy Faber, who without your support, this would not be possible. Thank you. Questions?
Stephanie, I feel the thank you should be coming from the board to you and the nursing staff. You've done a tremendous job. You continue to do a tremendous job. And this is very impressive, very, very impressive. So thank you.
Thank you.
Our next item on the agenda is consideration of the minutes of April 8th, 20th, 22nd, and 28th. Can I have a motion, please, for
Madam
approval?
Chairman, I move for the acceptance of those minutes.
Do you have a second?
Second?
Any discussion? Would you take a roll call, please?
Director Danielson,
Aye.
Director Wallace,
Aye.
Director Stewart,
Aye.
Director Nicholson,
Aye.
Director Epen,
Aye.
Motion passes. Thank you. Minutes are approved. Do we have any oral communication requests? Okay. Seeing none, we are now into written communications from Dr. Lenny.
Thank you. I have the April credential action items from the medical staff. We had 4 new appointments of medical staff members. The first is Dr. Thomas Harai, General Surgery. The next is Nina Katibi, Physician Assistant. Aline Moorhead, Perfusionist. And Christopher Wilkins, Physician Assistant. Temporary privileges were granted to Nina Katibi, Aline Moorhead, and Christopher Wilkins after approval by the Medical Executive Committee. For reappointments, we have 2 reappointments recommended for Dr. Jeannie Ahn, Nephrology, Dr. Albert Asali, Urology, Ambulatory Status, Dr. Khalid Beg, Family Medicine, Dr. Stacy Berry, OBGYN, Dr. Vaji Bastikian, Anesthesiology, Dr. Siobhan Calhoun, OBGYN, Dr. Kevin Gersten, ENT, Dr. Ashay Kale, Orthopedics, Megan Nguyen, Physician PA or Physician Assistant, Dr. Ajit Sandhu, Pulmonary Medicine, Dr. Surinder Sandhu, Anesthesiology, Ambulatory Status, Dr. Yasser Sharif, Anesthesiology, and Dr. Benito Valencia, internal medicine. We have one conditional reappointment, Dr. Edmundo Davila, family medicine, recommending a 6-month conditional reappointment. For completion of proctorship prior to eligibility for advancement of staff category, we have Dr. Christopher Carpenter, pediatric hospitalist, Dr. Kirk Lynn, gastroenterology, and Dr. James McGuire, neonatologist. And we have one resignation, Joseph Rial, physician assistant. And that's it.
Thank you. Do we have a motion for approval?
I move approval.
Second?
Second.
Roll call, please.
Dr. Danielson?
Aye.
Dr. Wallace?
Aye.
Dr. Stewart?
Aye.
Dr. Nicholson?
Aye.
Dr. Ethan?
Aye.
Motion passes. Thank you. Debbie,
Hi.
it's now time to hear about the Service League report, and you know what I want to hear about.
You want to know how the jewelry sale went, don't you? Well, I have some numbers for you.
Oh, good.
Yes. First of all, want to thank the hospital, the board, the community, the staff for supporting the jewelry sale. I think it went really well. We opened up into 2 rooms this year, which was great. Some people thought maybe that there wasn't quite as much stuff, but I said, take all that stuff over there and put it right into here. Can you imagine? They go, oh, yeah, I guess you're right. So it was good. We kind of set up differently, and it was very successful. Basically, what we try to do is we compare our numbers spring to spring and fall to fall. So this year, we still exceeded about $400 over last spring. So that's a good thing. We're always trying to go and do one better. We are commissioned, well, the total sales, let me give you that number first. Total sales that we made was $78,959.82. That's the total sales for the spring one. But our commission that we received was $14,291.73, okay? And what I would like to give you also is, since the jewelry sale has been going on for 8 years now, okay? It started in 2007 in the fall, and at this point, the jewelry sale gross has been $531,673.10, but our commission has been $221,812.52. So I think that's something that we're very proud of and want to continue going up and up and up in the future. Our next jewelry sale is going to be on November 30th, December 1st, and December the 2nd, which is the Monday, Tuesday, and Wednesday after Thanksgiving. Okay? Okay, Nancy's,
Got it.
yes, she's ready.
Just in time for Christmas.
Exactly. But I do want to give you guys an indication of what the EPDs, the employee deductions that that your employees are using for the jewelry sale. So this particular one, EDPs for this sale was $18,243.48. Okay, and overall since the start, it's been $341,138.01 for the last 8 years. So, you know, the payroll deduction is a good incentive for your employees, for the employees of Washington Hospital, and want to thank them for doing that, you know, because it makes our sale that much more successful, which makes it more successful for the hospital. Okay. Any questions on the jewelry sale at all?
No?
No?
I would say that it's quite successful.
Yes, it
I-
is.
I
And
didn't
I really
realize-
want to thank all our volunteers who put so much time into doing this. You know, Cherie, she does a wonderful job coordinating this. She spends so many hours and she's so organized, but she does a great job at putting it together. Jeannie and Gail on the registers, and Chris and Jose, and I mean, there's just numerous ones. Our treasurer, Sydney, for doing that. The EPDs, Marina Fleming, how she and her crew, there's too many just to name them all, but I just want to thank them because it really means a lot. We can't do it without them.
It's a nice team.
Pardon?
It's a nice team.
It is a team, and it works well and gels well. Teamwork, that's what it's all about. We also had an information session this last month, and we had 130 attend the information session in regards to volunteering, being 59 high school students, 38 college, and 33 adults that attended, okay? We want to thank the hospital for volunteer service luncheon that we had at the Marriott. It was delightful. Having Nancy speak and kind of informing the volunteers of what is upcoming, what's going on with the Morris Hyman Critical Care Pavilion, how the garage is going to be done soon next year. Fingers crossed. Things of that nature. I think it's very informative for the volunteers because sometimes they don't know what's happening as much. Also, for Dr. Shanta, he did a great job at thanking the volunteers from all the physicians. And that means a lot to volunteers because, like he said, sometimes we forget and not thank the volunteers, and that means a lot to the volunteers when we are thanked. So thank you. And I think I believe everyone got a newsletter. We put our newsletter out and I sent it to you all. And we started a little, I wanted to start something about the history of the volunteer service, especially with our 60th anniversary coming up in October. The celebration. And so Luis Fernandez did an article, and this is going to be ongoing for our newsletters, and we produce our newsletter every other month. So we want to just kind of give the volunteers where we all came from back there in 1955 and who was a part of it. And it's very interesting to look at the scrapbook that we have to see all the pictures. So that pretty much covers our month.
Thank you.
Thank
I think
you.
that's a good project for the history.
Yes.
Newark is going to be 60 this year as well.
Oh,
And
that's wonderful.
as the city ages, the residents of the city also age.
Yes.
And it's important to put those memories down so that they can be collected before they're forgotten.
Exactly.
And also the photographs as well, before
Yes.
somebody throws them out accidentally.
Yeah, we have them all in books, and then it's all been put on a disc.
Good.
So,
Good.
and I believe Nancy has a disc. Yes.
All right.
Because there's a lot of, I mean, it's not just the Service League. We have a lot of hospital history in our scrapbooks.
Right. Thank you.
You're welcome.
It's a good report.
Thank you.
Nice to hear. And I've got the dates written down.
Okay, good. I can't wait to see you.
I'll be there. Our next item is the medical staff report, again with Dr. Lenny.
Thank you. I just want to say, in light of Nurses Week being last week, I want to acknowledge our nurses on behalf of the medical staff and the excellent job they do. There was a time not so long ago that during my training at least, that hospital care of patients was very physician-centric, and nurses were just sort of a means by which the physician's orders were transponded to patient care. But I think what the expectations of modern-day hospital medicine is that it's a treatment team, and nurses are a critical part of that team, and that's the way I practice, and I'm proud to have our nurses on my team. So to our current medical staff, we currently have 544 members of our medical staff, 338 active members, 62 ambulatory, 94 provisional, 26 courtesy, 15 allied health, 3 consulting, and 3 administrative. And we currently have 4 applications, 4 of which are in the pre-application stage, and 10 formal applications, 13 of which are from physicians and 1 from a nurse practitioner.
Thank you. Our next item is the hospital calendar.
Okay, we'll start with the video.
Past health promotions and outreach events. On Friday, April 17th, Kitayama Elementary School in Union City hosted a health fair for students, teachers, and parents. Washington Hospital nurses, staff from respiratory care, and representatives from Washington Township Medical Foundation provided information on asthma, hand hygiene, and provided blood pressure screenings. 25 people were screened, and 200 people attended the event. On Saturday, April 18th, Washington Hospital hosted the 9th Annual Women's Health Conference. Dr. Victoria Leapart, gynecologist, moderated the event. The event featured topics on prevention and treatment of gynecologic cancers, followed by an overview of the latest clinical trials. Other topics included treatment options for menopause, healthy knees, and nutritious meals on the go. 60 women attended. On Tuesday, April 21st, Dr. Bruce Lynn, radiologist, presented Relieving Chronic Pain, Know Your Options. 24 people attended. On Saturday, April 25th, Washington Hospital's Green Team, the City of Fremont, and other local Tri-City organizations organized the Let's Go Green Together event. This free Earth Day Education Expo raised environmental awareness and shared eco-friendly ideas with people in our district. Attendees learned about recycling and how to save energy. Attendees also learned about native plant options and selected free plants for their personal yard or garden. Approximately 1,000 people attended. On Monday, April 27th, May 4th, and 11th, Dr. Victoria Leapart, gynecologist, presented Restoring Balance, a 4-week stress reduction program. 11 people attended. On Tuesday, April 28th, Michelle Heading, RN, Spiritual Care Coordinator, presented Future Planning and Advanced Healthcare Directives. 25 people attended. On Friday, May 1st, Dr. Alexander Saw, orthopedic surgeon, presented Treatments for Knee Pain. 40 people attended. Also on Friday, May 1st, the Washington Hospital Sports Medicine Program provided athletic trainers and hosted a first aid booth at the Track and Field Special Olympics held at James Logan High School in Union City. Over 480 student athletes participated in this event. On Thursday, May 7th, as part of the Diabetes Matters series, Dr. Khalid Beg, Family Medicine, presented What Do All Those Labs Mean? Understanding and using your results to improve diabetes management. 11 people attended. On Saturday, May 9th, Washington Hospital staffed a booth at the Healthy Kids Expo at the Silliman Activity Center in Newark. Coloring books and information on health resources were provided. Over 500 people visited the Washington Hospital booth. On Monday, May 11th, Washington Hospital hosted the annual Employee and Volunteer Health and Safety Fair. Over 20 wellness booths were set up to educate staff and volunteers on how to best maintain health and safety for themselves as well as for patients. This event was part of the National Hospital Week celebrations, which began on May 10th and will continue through May 16th. National Hospital Week celebrates hospitals and the staff and volunteers who day in and day out support the health of their communities through compassionate care, constant innovation, and unwavering, unmatched dedication. Upcoming health promotions and community outreach events. On Thursday, May 14th, from 7 to 8:30 p.m., Washington Hospital will host Celebration of Life. This event will feature stories of survival and hope for cancer survivors and their families. The event is sponsored by Washington Hospital, HERS Breast Cancer Foundation, Palo Alto Medical Foundation, and the American Cancer Society. On Tuesday, June 2nd, from 1 to 3 p.m., Dr. Dale Amanda Tyler, otolaryngologist, head and neck surgeon, will present The Real Impact of Hearing Loss and the Latest Options for Treatment. Also on Tuesday, June 2nd, from 6 to 8 p.m., as part of the Stroke Education Series, Dr. Ash Jane, cardiologist, Doug Van Houten, RN, and Luann Sodweste, RN, will present Living with Stroke and Future Diagnosis and Management. On Thursday, June 4th, from 7 to 8 p.m., as part of the Diabetes Matters series, Dr. Prasad Kata, endocrinologist, will present Diabetes Ups and Downs, Troubleshooting High and Low Blood Sugar Levels. On Friday, June 5th, from 9 a.m. to 1 p.m., Washington Hospital will participate in the Four Seasons of Health Expo organized by the Tri-City Elder Coalition. Washington Hospital staff will provide osteoporosis screenings and health insurance information. On Saturday, June 6th, from 10 a.m. to 1 p.m., Dr. Ash Jane, cardiologist, and Dr. John Thomas Mahegan, vascular surgeon, will screen community members for peripheral vascular disease. This free screening includes a Doppler study of the circulation in the legs and an interpretation of results. Appointments are available for screenings at this event. To register, please call 800-963-7070. The Washington Hospital Healthcare Foundation Report. The Washington Hospital Healthcare Foundation's 30th annual golf tournament took place on a spectacular spring day on April 27th at Castlewood Country Club. Approximately 200 golfers participated in a terrific day of golf along with fun surprises on the course. Thanks to our generous sponsors and golfers, the tournament generated over $72,000 for surgical services at Washington Hospital. The winner of the Corporate Challenge Cup this year was the team from Fremont Bank. Mark your calendar for next year's golf tournament on April 25th, 2016. On April 29th, at the annual Pathways to Success Scholarship Luncheon hosted by the New Haven Schools Foundation, the Washington Hospital Healthcare Foundation presented a $1,000 scholarship to Ama Prempe, a graduating senior from James Logan High School in Union City. Ms. Prempe has been accepted to Princeton University in the fall of 2015, and she plans to study international relations with an emphasis on global health. The Washington Township Healthcare District Board of Directors report. In the past month, District Board members represented Washington Township Healthcare District on April 16th at the Newark Chamber of Commerce's State of the City address delivered by the Honorable Al Nagy, Mayor of Newark. They also attended the Fremont Leadership Prayer Breakfast on April 17th, the Hearst Breast Cancer Foundation's People with Purpose Luncheon on April 23rd, Citizens for Better Community Spring Celebration on April 25th, the Music at the Mission's Mystique of Paris Gala on May 1st, the Newark Optimist and Rotary Club's Pancake Breakfast on May 2nd, the Viola Blythe Community Services Volunteer Recognition Dinner on May 6th, and the Indo-Americans for Better Communities Charity Ball on May 9th. Washington on Wheels WOW Mobile Health Clinic. During the month of April, the Washington on Wheels Mobile Health Clinic WOW continued to serve community members at the Fremont Family Resource Center, the Fremont Senior Center, the Ruggieri Senior Center in Union City, and Breyer Elementary School in Fremont. The total number of community members receiving health care at the Washington on Wheels Clinic during the month of April was 47. Internet marketing. Washington Hospital's website remains very active. The hospital's Physician Finder section was April's most viewed webpage with 15,251 views. InHealth, Channel 78. During the month of April, Washington Hospital's cable channel 78, InHealth, captured new programming, including a Diabetes Matters program called Gastioparesis, 2 health and wellness programs entitled Relieving Chronic Pain, Know Your Options, and Future Planning and Advanced Healthcare Directives, the Citizens Bond Oversight Committee meeting, and the April Board of Directors meeting. In addition, InHealth completed production of the Washington Hospital Experience, the Birthing Center, which is hosted by Fremont resident Sherry Sabra and features interviews with staff and mothers who have delivered at the center and provides an overview of all the services offered by Washington Hospital's Birthing Center. Awards in recognition. Washington Hospital and several staff physicians were recipients of the Best of Fremont 2015 Awards and Honors. Readers of the Bay Area News Group newspapers cast votes online to determine recipients. Washington Hospital was the recipient of the Best Hospital Award, and Dr. Alexander Saw was awarded Best Doctor and Best Orthopedic Surgeon in Fremont. Best Health Clinic and Best Pediatrician honors were bestowed on Dr. Rodora de la Cruz. In addition, several physicians from Washington Township Medical Foundation were also honored, including Dr. Jan Henstorf, who received a Best Orthopedic Surgeon honor. Doctors Christina Wong and Victoria Leapart received Best OBGYN honors, and the Women's Health Specialist Clinic was also recognized with Best OBGYN honors. Additional events. On Monday, May 4th, Washington Hospital hosted a Rose Garden Remembrance event. This event provided an opportunity for the hospital community to remember employees, physicians, volunteers, and board members who have passed away while serving Washington Hospital. Employees Ernesto de la Cruz and Rochelle Freitas and volunteers Geraldine Clarich and Deacon Louise Tricios were remembered during this event. Michelle Heading, Spiritual Care Coordinator, provided non-denominational reflections. For more information on any of the programs mentioned, visit whhs.com or call 1-800-963-7070, and please follow us on Facebook and Twitter.
Takes a minute to adjust to the light. I wanted to mention that the green event that was shown in the calendar report here is something that the hospital does with the city of Fremont. And on the hospital side, our chief of biomedical engineering, Paul Kelly, is the go-to guy for this. And he puts in untold numbers of hours helping put this together and making it such a terrific event. So I think Paul is very deserving of credit, and if you run across him, say thank you. He's done a brilliant job. I wanted to talk a little bit about the publication of the leapfrog data, which occurred recently. Washington Hospital received a B grade, despite being one of more than 1,000 hospitals in the country that do not pay leapfrog to participate in the survey. Hospitals that don't participate in this survey are mathematically limited from scoring the maximum number of points in several categories based on their methodology. Leapfrog is among dozens of watchdog organizations that routinely monitor hospitals for safety and overall effectiveness, and Washington Hospital continues to receive scores well within national benchmarks. However, according to a recent article in the New England Journal of Medicine's Journal Watch, rating systems seldom agree due to varying criteria used for each survey and do not produce reproducible results. A quality report is provided to the Board of Directors every month at a meeting that's open to the public, this meeting, taped for TV broadcast, and also posted on YouTube. The data shared in this public report not only covers a range of data requested by the Leapfrog group, but covers a wider range of quality indicators than their group requires. Consumer Watchdog has been on a year-long campaign primarily funded by trial lawyers to lift the medical malpractice cap enacted under MICRA, and its mischaracterization of the overall safety record of California hospitals based on leapfrog scoring is just another part of that political effort. Fact is that MICRA's been incredibly effective at keeping medical malpractice costs in check for 40 years and has saved lives by making it affordable for doctors to practice medicine in California. I wanted to put the leapfrog data in context. If we paid each one of these rating agencies what they demand and require, that would be money the district would not spend here. And their fees are substantial, very substantial. So this is not an organization we've participated in. And I wanted the board and our public to have a sense of context about all of this. Thank you.
We have a construction report.
Oh, wait a minute, I forgot Employee of the Month.
Oh.
Thank you. Oh, I'm so sorry. It's Leslie Saito. She's our Employee of the Month. She's a senior clinical lab scientist in the laboratory department, and she's part of the Ambulatory Care Services Division. She's our May Employee of the Month, and she is very much valued by her peers. Her knowledge, integrity, and compassion in patients, her dedication, Her friendly nature makes her an excellent team player and a perfect candidate for this award. She first came to Washington Hospital in March of 1976. For almost 40 years, she has been a pillar of the chemistry department with roles as lab assistant, lab technician, clinical lab scientist, and hematology lead. She's absolutely reliable. She has an eye for quality and accuracy and is a model clinical laboratory scientist who enjoys sharing her knowledge with her laboratory family. She's very knowledgeable of what she does, and yet she's very humble. She's a great teacher. She's friendly, compassionate, and very conscientious of releasing accurate and timely results, which goes to the very heart of the mission of the clinical lab. This is a core requirement needed for diagnosing and treating patients. So Leslie is our Employee of the Month for May, and I wish her well and many congratulations.
Now the construction report.
Can I introduce Robert?
You certainly may.
Ed is away attending family graduation. So tonight we have Robert Alfieri. He's our Chief of Facility Services. And after he was discharged from the U.S. Navy in 1980, he earned an associate's degree in biomedical electronics from Napa College. He worked as a biomedical technician and supervisor for several major California medical centers. In 1986, Robert was recruited by Davies Medical Center in San Francisco, which is now part of California Pacific Medical Center, and he relocated to the San Francisco Bay Area. Over the following 12 years, Robert's responsibilities grew to include facilities engineering and construction management. In 1998, he took an assignment with the San Francisco-based Able Engineering Services firm as chief engineer for Sutter Delta Medical Center in Antioch, California. He later became assistant director of facilities for Alameda County Medical Center in Oakland in 2001. In 2002, he successfully completed Cal State Hayward's 2-year Facilities Project Management Certificate Program. In 2007, he joined Washington Hospital Healthcare System in Fremont as our Director of Facilities Services. With that, I'd like Robert to make a presentation on our construction.
Thank you. Good evening. We'll start with a construction update. I'll hopefully answer some questions. We'll start with the parking garage. Pictured here is the starting of excavation for footings. After the footings are excavated, they put in rebar, steel. Steel is then covered with concrete. They get the concrete using a pumper truck, which is stationed on one side of the site. The cement trucks come by, fill up the pumper truck, and it's delivered to all parts of the site. This allows us to get to the site without having the trucks to actually traverse through the actual construction site. This is starting the installation for the columns, rebar, and shear walls. Building of the shear walls continue. Again, the pumper truck is taking concrete to filling up the actual shear walls. This is the beginning of the masonry brick walls that they're putting in. This is going to be the beginning of the actual ramp that starts on the first floor. The forms now are being removed after the concrete is dried, stripping the shear wall forms. And this is a picture showing the columns coming in. They're getting ready to build the casings around it so they can pour concrete and make those the columns. To answer the question, there was a question earlier, are we on schedule? Yes, actually we're a little ahead of schedule. We're actually 3 weeks ahead of schedule. So the February date is still a good date. Okay. Moving on to the Morris Hyman Critical Care Pavilion. This is the beginning of the excavation. The H-piles that you see behind are the actual beginning of the shoring. Now they're starting to excavate down. This is looking at the east elevations. This is a little out of context. Well, let me explain the context. That concrete that you see right there is about 5 to 6 feet deep. So that's showing you a 12-foot deep hole. So we're down that far. They dig down 5 foot sections, and then they put the concrete in. This is the second lift as they continue to excavate. This is a bird's eye view to show you the size and the scope of the site. Trucks coming through, it's constant. This is a machine that actually drills for the tiebacks. This is part of the actual shoring system. This machine will drill a hole about 6 inches wide. It goes in about 40 feet deep. It's on an angle. When they finish drilling that hole, they will fill it with a cable. That cable then is filled with concrete, and when it's dried, it will be used for the actual the shear wall itself to hold the wall up. Another picture. This shows them actually shooting in the concrete, shotcrete. So that's about 15 feet deep. When we're done, this will be about 30 to 35 feet deep. And there's the schedule. On schedule as well. Any questions? Thank you.
No questions? Thank you. Our next item is our quality report. Nancy, would you introduce
I
Mary,
don't need
please?
to introduce Mary. She's been here frequently. Well, just rely on everybody to remember.
Thank you.
I wanted to discuss a little bit about the Centers for Medicare and Medicaid Services value-based purchasing program. This is an initiative that has been started by CMS in October 1st, 2012. And really what it is it's a program that CMS created to where they would switch the focus on sort of the quantity of care that we're providing patients to looking more at the quality of care that we're providing. And they do that by creating a set of measures and seeing how well we perform on each measure and what efforts we've made to improve on measures that we may not be doing so well on. The goals of the program are to advance quality to the care provided and to really improve patient outcomes, make our environment safer in the hospital, and to improve the experience that patients have while they're here at the hospital. We want to evolve the way care is delivered to Medicare patients and to link outcomes and treatments to a value-based payment system. So how do they reward hospitals for this? Well, I think first it's important to look at how they funded the program. In order to get this program up and running by CMS, they had each hospital take a reduction in our reimbursement for payments. So our DRG payments were automatically just reduced to fund this program. And the way that you can sort of get some of those funds back is by participating in the program and making your total performance score high enough to where you won't take the entire 2% reduction in payment, which can be pretty significant. For example, in our year here, 2015, our outcomes will be used to influence our 2017 payments and reduction in payments based on these outcomes. So to give you an idea of how they score this, they look at two different things. The achievement score, which is how well are you doing on each measure compared to the national average. The second way they score it is by looking at the improvement score. They took a baseline of the measurements in 2012 and they looked to see have you improved in each one of your the ways that they measure the program, which I'll discuss in a minute. So they look at those, they come up with a score that ranges from 0 to 10 points. They look at different domains and they're weighted differently. So there's 5 domains in hospital value-based purchasing. One is looking at your process. Are you providing the right care at the right time? A good example of this would be core measures. And outcomes and safety. So what are some outcomes that you're having with your patients? Are they having catheter-associated urinary tract infections? Safety would be things like how safe is the environment, or what's your falls rate, that sort of thing. And patient experience. So it's the perception of the patient based on a survey they fill out after discharge. It goes over things like how clean was the environment, how quiet was it, how was the communication between doctors and nurses, those sort of indicators it looks at. And efficiency, which basically in the summary of efficiency, it means, are you providing the best quality care at the lowest cost possible? That's really how they measure efficiency. And all that comes together to create a total performance score. So I mentioned that they're weighted differently. And if you look back here on fiscal year 2013, you could see a huge part of the focus of hospital value-based purchasing was set at 70% was looking at the clinical process of care. Again, did you provide the right care at the right time? But as we've shifted through the years, that's getting less and less. And now we're looking at the bulk of what they are looking at for your taking away your incentive payment is 45% looking at clinical outcomes and safety. So the measures do shift, and they're updated frequently. So if a measure becomes what they refer to as topped out, like for example, if your compliance for core measures across the nation gets well, everybody's doing 97, 98% compliant, they say, oh, okay, the nation's got this standard down, let's remove it, and now we're going to replace it with something new for the hospital to focus on. So some of the things that they've focused on have been, are we offering our patients influenza immunizations, looking closer at surgical site infections, perinatal care measures, your hospital-associated rates like C. diff, MRSA, and mortality measures. And you can see they removed the ones that I mentioned earlier, like how you manage a pneumonia patient or a heart failure patient or a patient that has a surgical care improvement project is a skip patient otherwise. It's a core measure, basically. So those were removed once the nation really topped out on those measures. Outcomes, again, is a big focus with regard to clinical process. So I want to get into specifically what our scores are and how well we're doing here at Washington Hospital. And I think this is a good snapshot for the community to say, you know, when they're making decisions about where to go, you can see really what are the clinical quality outcomes at your hospital. So specifically to us, we've done really well in the clinical process area. Again, our baseline started in calendar year 2012. You can see our percentages in that column and how they've improved in the far right-hand column here, where on every single one that we're eligible for has shown significant improvement. And looking at our healthcare-associated infections, we've been able to show an improvement from 2012 to 2014 also in those in 3 out of the 4 healthcare-associated infections, and been higher than the national average. Patient experience, as I mentioned before, what these examples of patient experience are, they're there again along in the column. So again, how well do we manage patients' pain when they're here? How are we communicating with them, setting up the discharge process, those sort of things. We've been able to really make improvements in about 6 out of the 8 of those patient experience measures, and have been able to improve patient experience compared to the national average. So those are the focus areas for value-based purchasing. Our future direction is really to just keep a focus on evaluating any improvement opportunities that we can. And I think here, what we really try to remember in quality is we don't just do this because it's incentive payment or because it's something that CMS has implemented. This really comes from the core of our patient-first ethic. You know, that's the real reason why we want to focus on these outcomes and make sure that we're providing the best care for our patients. And we do use this as a guideline for deciding where we should focus, and just making sure that we meet goals and that we can improve and become better than the national average. And as a result, hopefully continue to receive CMS incentives with the goal. That's it. Any questions?
Are there any questions from the board?
Thank you.
Thanks. I think the important thing about this is recognize it's a moving target, and as soon as hospitals are successful in doing any of these things, they move it and make it something else. So, you know, there are times when I look at this stuff and wonder how much it really has to do with quality. Only 5% in this current year is related to clinical processes. But that's why patients come to the hospital. And it mystifies me how they come up with these. Just, I think it's about denying payment more than it's about quality.
Thank you. It's the world we live in.
Yes, it is.
I think we're ready now for our finance report. And following your lead, Nancy, I don't think Chris really needs an introduction. But he is our chief financial officer, the man with the numbers.
I was all ready to tell you not to go away because it was worth waiting for while they got my slides up, but they got it done. Okay, so tonight we're going to take a look at Washington Hospital's operating and financial results for March 2015. Average daily census for the month was 22.2 above budget at 184.7, and you're going to see this theme roll through the entire presentation. March was a great month. We had 1,156 admissions, 117 above the budget. Our patient days were 686 above budget at 5,025. Observation equivalent days for the month were 44 above budget at 270. Our average length of stay for the month was right on budget at 4.86. We'd expected 4.85. Looking at utilization, case mix index came up in April. We've been seeing that number below 1.5. For April, it was 1.539. We had 162 deliveries for the month, so deliveries continue to trend above budget. In April, they were 8 higher than what we expected. Surgical cases were 53 above budget at 407. That includes our joint replacement cases that were 25 above budget at 141. Neurosurgical cases were 6 below budget at 23. Cardiac surgical cases were 3 above budget at 12. And our cath lab procedures were 237 above budget at 852. Outpatient visits in April were 119 higher than what we expected at 7,946. In the emergency room, these numbers just seem to be the new normal. 4,867 visits in our emergency room in April. We had expected 4,336. So they don't seem to, it just doesn't seem to be letting up in the ED. Quick look at our cath lab mix for April. Peripheral vascular actually stretched this month, 45% of the activity. Cardiac was 33%. Non-vascular interventional radiology made up 17%, and our neuro IR was 5% of the volume. Looking at productivity, productive FTEs were 42.5 above the budget at 1,222, and with that kind of activity, folks were flexing up and actually were really working hard. Non-productive FTEs for the month were 9.3 above budget at 141.6. So we ended April with total FTEs 51.8 above the budget at 1,364. However, our FTEs per adjusted occupied bed, which was our productivity measure, we expected 6.13. In April, it was 5.55. So folks were really working hard to keep up with that volume in April, and even though the FTEs and resulting labor costs were above budget, I mean, they were working hard and actually staffed lower than we expected. So let's look at the financials. All of this rolls into financials, and you're going to see the same theme here. Total patient revenue for the month was $25.7 million above budget and $199,046,000. Our contractuals for the month were actually appear to be right on budget. We really didn't budget that good. There was a few trailing decimals that we were off. But that's lower than what we've seen in the last few months, and there's a couple things impacting that. We did receive notification of a state intergovernmental transfer program payment that we're going to receive. And this is the program we've talked about in the past. The state of California's Medi-Cal program does not fund enough payment to hospitals to draw down all the federal matching funds that are available to California. They leave millions and millions of dollars on the table. So, district hospitals got together through the District Hospital Leadership Forum and lobbied the state to help us put up our own money to go and get that matching contribution, which we have done. So this year's IGT is going to be worth about $1.8 million to us, and that's reflected in the contractual allowances. Also, we had a reserve on the books of about $900,000 for a claim from UnitedHealth, which they've dropped. So we brought that reserve in. So we ended April with net operating revenue almost $5.8 million above the budget at $46,402,000. Operating expenses for the month came in actually pretty good given all the activity, $195,000 above budget at $39,278,000. We had some offsetting things going on there. We had unfavorable variances, I mentioned, in labor costs and our supplies, and all of that driven by the volume. Those were offset by favorable variances in purchase services and bad debt, as we have seen over the last several months, lower than we expected in the budget. So we end April with an operating bottom line, $5.6 million above budget at $7.1 million. Non-operating expenses, and of course this is our GASB format look at this, which is the format we use for our audited financials. We had an unrealized gain on our investments of about $147,000 in the month. We end up April with non-operating income of a little less than $1.2 million and a total bottom line $5.7 million above the budget at $8,312,000. Quick look at our FASB presentation. This is the way, it's a representation of how the financial markets look at us. Operating bottom line stays the same as in the GASB presentation. We do pull out our tax revenue that services our general obligation bonds and that unrealized gain on our investments to come up with non-operating income from a FASB perspective of $256,000 and a total bottom line of almost $7.4 million for the month of March. So are there any questions on March? I have been saying April, haven't I? I'm back up every place I said April, it's March.
You ready for April?
I think we are ready for April,
Okay,
the real April.
the real April.
This is good too.
We saw 985 patient admissions that resulted in an average daily census of 158. Admissions were 65 in number, higher than we had budgeted, and our average daily census was roughly 10 patients above each day. The average daily census recorded in April was 3.3% higher than our average daily census recorded 1 year prior. The high and low ranged from 177 down to 130. Outpatient observation equivalent days of 283 were higher than we had budgeted. We'd budgeted 203. So they were 80 higher and also higher than April a year ago by 33. Our average length of stay for adults and children in April was 4.86. We had budgeted 4.82, so just slightly higher. And this length of stay was unchanged from March. The birthing center saw 157 deliveries in April compared to a budget of 130. April's deliveries resulted in 334 baby days of care. Our newborns totaled 157. By comparison, there were 133 deliveries in the hospital a year ago for the same month. For the month of April, there's 391 surgical cases, 21 above the budget, of 370, so that's a 5.7% positive variance. The surgery activity includes cardiac surgical cases that were 2 above budget, totaling 11. Neurosurgical cases that were 8 above budget at 29 cases. Joint replacement cases that were 16 above budget at 137 cases. And general surgery cases came in below budget by 5. They had 214 cases. Inpatient surgical cases during the month were below budget by 14, while outpatient surgeries were above budget by 35. 605 cases were seen at the outpatient surgery center. They had budgeted 496. That's a huge variance. For the month of April, total procedures in the cath lab were 651. We had a budget for 613. Cath lab volume a year ago was 605 procedures. So this is a progressively higher volume. Overall, inpatient cath lab procedures were 72 more than anticipated. That's a 23.8% positive variance. Outpatient procedures were 34 fewer than we had expected. 11% negative variance for the outpatient work in the cath lab. The cath lab activity included cardiac procedures that were 20 above budget. That's a positive variance of 13.5%. Peripheral vascular procedures that were 3 below budget. Neurointerventional radiology procedures that were above budget by 11. And non-vascular interventional radiology procedures were 13 higher than we had budgeted. Non-emergency outpatient visits for April totaled 7,565. They were 110 lower than the budget of 7,675, and they came in slightly lower than April last year. Emergency room recorded a total of 4,468 patient visits in April. 490 above budget, positive variance of 12.3%. The daily average for the month was 149 visits a day. They're really experiencing a lot of pressure in the emergency room. The Washington, Warm Springs, Newark, Nakamura, and Ohlone clinics saw approximately 3,955 patients during April, 19 fewer than we had budgeted. So our total system emergency room and clinic visits for April were 8,423 compared to a budget of 7,952. Full-time equivalents for the month of April totaled 1,336.1. It included 15.8 agency personnel. This was 51.8 FTEs higher than the budget. Productive FTEs were above budget by 52.5 for the month. Non-productive FTEs came in at 0.7 of an FTE below budget. Productive FTEs per adjusted occupied bed were 5.51 in April. This is a 2.8% variance below the budget. Total FTEs per adjusted occupied bed were 6.26, which is 3.4% below our budget. Patient mix. Our preliminary information indicates that inpatient revenue for the month of April amounted to approximately $132 million compared to a budget estimate of $121.5 million. 57.7% came from Medicare-sponsored patients, 17% from Medi-Cal-sponsored patients. Medi-Cal is above budget. The budget had called for 16.8%. Total government program revenue for April was 74.7% of our total inpatient revenue. We had budgeted 74.4%, so it's a small variance. Based on April's 4,728 patient days, 50.8% were Medicare-sponsored days. We had anticipated 56.6%. 20.8 were Medi-Cal-sponsored days versus a budget of 18.9%. Total government program patient days for April were 71.6% of our total inpatient days. We had budgeted 75.5%. That's a good variance because the government programs don't pay for the full cost of care. In terms of revenue for April, we had $178.7 million. This was above the budget by 9.7%. And it included inpatient revenue that was above budget by 10.5 million, positive variance of 8.6%. Outpatient revenue that was above budget by 5.3 million, or a 12.7% positive variance. The inpatient revenue variance is driven by higher levels of activity in the cath lab and associated ancillary services. Outpatient revenue was higher than budget primarily due to the increased outpatient activity in the OR, cath lab, and emergency room. In summary, we had 65 more admissions, 295 more inpatient days than we had anticipated in the budget. Our surgical cases were above budget by 21. Cath lab procedures were above budget by 38. Outpatient visits for April came in below budget. Emergency visits were 12.3% higher than we'd anticipated. Clinic visits were below budget by 0.5%. Total paid FTEs were above budget for the month and above the last 12 months average. However, the FTEs per adjusted occupied bed were below budget by 2.8%, and that's the sensitivity measure for volume as it relates to staffing. Our total hospital charges for April were above budget by approximately $15.8 million, or a 9.7% positive variance. On April 30th, there were 189 days cash on hand, up from the March total, which was 186. The total days revenue and accounts receivable at April 30th was 56.0. It's a huge result. Business office is clearly doing a good job. The days revenue and accounts receivable, excluding Medi-Cal, was 52.8. During the month of April, $614,980 of charges were approved or are pending for charity assistance.
Thank you, Nancy. We have a few remaining action items to consider, starting with B.
Item B. Madam President, in accordance with district law, policies, and procedures, I move the Chief Executive Officer be authorized to enter into the necessary contracts and proceed with the purchase of the hardware, software, and implementation services of the Siemens Building Control System for a total not to exceed $218,000.
Second.
We have a motion and a second. Do we have discussion on that?
I just wanted to let people know what it is.
Please.
The Siemens Building Control System has been installed in increments at our hospital starting in 1980. And as the campus expands, the system was also expanded. This project will consist of upgrading the 2000 Maury Avenue campus maintenance system. This system controls the heating, ventilation, and air conditioning, water, steam, and electrical distribution, and allows the programming of the systems for the comfort and energy efficiencies. The system's infrastructure will also be updated to allow for a switch from an analog to digital format, resulting in increased monitoring points and improved speed for the entire system.
Okay. Christine, would you please take roll call?
Director Danielson?
Aye.
Director Wallace?
Aye.
Director Stewart?
Aye.
Director Nicholson?
Aye.
Director Epen?
Aye.
Motion passes. Thank you. Our next item, C, please.
Madam President, in accordance with district law, policies, and procedures, I move the Chief Executive Officer be authorized to sign the appropriate documents to proceed with the purchase of earthquake and owner protection professional liability insurance for the Phase 2 building project, the Morris Hyman Critical Care Building, and to approve a budget amendment for the construction project in the amount of $1,200,000.
Second.
We have a motion and second. Nancy, can you fill us in on some background
Yes, we
information?
have consultants that advise us on insurance matters, and I think many of you have met Bob Ford, and he has advised us that this would be an important thing to consider due to the relative affordability of this kind of coverage, and it protects the district while the building's under construction. Historically, we've not purchased earthquake insurance due to its prohibitive expense. But for this particular aspect, it protects the building while it's under construction. We've been advised that this would be something that we should do.
Thank you. Christine, would you take the roll call, please?
Director Danielson?
Aye.
Director Nicholson?
Aye.
Director Epen?
Aye.
Director Wallace?
Aye.
Director Stewart?
Aye.
Motion passes. Thank you. Next is item D.
Madam President, I move the appointment of Craig Steckler to the Citizens Bond Oversight Committee to fulfill the vacancy that has existed since December 2nd of 2014, and that his term will run until December 31st, 2016. For clarity, the terms of the other committee members, Albert Hueso, Jack W. Balch, and Kevin Holm, will run until December 31st, 2018.
Second.
We have a motion and a second. Nancy, would you remind, where did the opening come from? Who left?
Geez,
Can't remember? That's okay.
I can't remember right now, I'm sorry.
Moved to Arizona.
Oh,
Okay.
No, I don't remember. Is it?
Okay. Sorry, I
Lowe,
didn't mean-
Lowe.
Lowe?
Ken Lowe?
Jim Lowe.
Yeah. I think the important part about this that the public should be aware of is that unlike school districts, we're not required to have a Citizens Bond Oversight Committee. This is something the board has provided the community in a commitment to transparency. And this committee is also televised on our local access cable station when they meet. The reason why they haven't met very much since December this past year is because we weren't actively in construction. So now that we are, and the projects, both the parking structure and the Morris Hyman Critical Care Pavilion are now underway, they'll meet quarterly. And they'll be much more active. But there was a period of time in which we weren't actively building, and so there wasn't a need for them to meet.
I think Craig is an excellent selection. I've worked with him on a SAVE board for a number of years now, and he's a good person. He'll do a fine job. Good addition to the Oversight
I
Committee.
think so too.
Yeah. Thank you. Okay. Christine, it's your turn now.
Did they have to vote?
Yes.
They did vote.
No, did we
No.
vote?
Okay.
No,
Oh,
no,
okay, all right.
no.
Director Danielson?
Aye.
Director Nicholson?
Aye.
Director Epen?
Aye.
Director Wallace?
Aye.
Director Stewart?
Aye.
Motion passes. Thank you. And I believe we're up to our last item.
Item E. Madam President, I move for the adoption of Resolution Number 1153, which is the recognition of the therapy department, including physical therapist, therapy assistants, occupational therapists, speech and lymphedema employees, as now being represented by the Engineers and Scientists of California Local 20, IFPTE, AFL-CIO, and CLC, a recognized majority representative under the terms of Board Resolution 331A, effective May 13th, 2015.
Second.
Thank you. I have a motion and a second. I don't think we need any further explanation on this. Is there any discussion from anyone? No? Okay. Christine, would you take
Director Danielson?
Aye.
Director Nicholson?
Aye.
Director Epen?
Aye.
Director Wallace?
Aye.
Director Stewart?
Aye.
Thank you. Motion passes. And with that, we will adjourn to a closed session. We are reconvening to open session and reporting there was no action taken in the closed session. With that, this meeting is ended.